Hello, hello. Hi, everyone. My name is Jennifer Waters, and I am part of the CNY Fertility and CNY Healing Arts team here in Syracuse, New York. And today I'm going to be sharing with you some information about light therapy. Believe it or not, I get a lot of emails and inquiries about the different kinds of light and people wanting more clarification about which modality is going to serve them best. So I love those questions, and I created this slideshow to share with you the differences and the similarities and how you are going to best benefit from which modality. So let's get going. This information is just to share. I'm not diagnosing or treating. I do work, just a full disclaimer here, I do work with multiple different light therapy companies, so I am going to be biased towards them. Obviously, people ask me all the time if they should buy things they find on Amazon or different lasers and this and that. And I always say, yes, buy what you can afford, buy what you're drawn to, incorporate whatever kind of light modalities you have available to you. So I truly want what is best for you. What I want to do is just clarify the differences and some of the confusion in light, and to make things simple so you know what to look for, whether you are looking for another practitioner in your area that's using light. You'll see in a moment how the confusion related to light and how we can clarify that and simplify everything. So what we're going to talk about is the definition, specific acronyms, a little bit about the history of light. I believe I have some slides in there. Remember, light goes back to the sun. And as long as we've been alive, we've had the sun. So fast forward to now, there are obviously multiple different companies that create light therapy devices. And so, but the history of light is very rich and interesting history of using the sun as a modality for healing and Egyptian healing in all different, all over the world. People have used light to heal their skin, to help with depression. And you really can't go wrong. Obviously, there's a lot of fear and concern now about UV rays being harmful and causing cancer and all of that. I still believe, yes, you have to be wise and not overexposed to the sun, but a lot of it is what's going on internally, what's going on inside of you, and the sun activates that, because I believe in terrain theory. So we'll get into the different acronyms with light, the benefits of light, the mechanisms, all of that, the science of light. So here are some of the acronyms when you search light, what you're going to encounter: LLLT, low level light therapy. Not to be confused with LLLT, which is low level laser therapy. And then you'll hear people talking about, oh, I have an LED device. LED stands for light emitting diodes. PLT is polychromatic light therapy, poly meaning more than one color. So there's all different colors that can be used: red, blue, near infrared, which is invisible. Some companies use violet, there's green, there's all kinds of color, and each color is considered frequency, and each frequency has a different effect on the body. So my favorite is the PPLLT, which is progressive pulsed low level light therapy, meaning that there's a pulse in the light. It starts at one frequency and it goes up in hertz and different frequencies. So that prevents what we call tachyphylaxis, which is a fancy word that means adaptation in the brain. So to create lasting change in the body, we need this progressive pulse to induce collagen, whatever we're doing with the light. The progressive pulse is going to help the most, because then the body doesn't adapt. And believe it or not, the body likes change in order to heal. PBM is photobiomodulation, photo meaning light, bio meaning biology, and modulate meaning to change. So it's light stimulating your biology to do what we were designed to do, which is heal ourselves, just self-heal and self-repair. If you're not healing on your own, you have to ask yourself, why? What is inhibiting that? And then we have PBMT. It's the association, the Photobiomodulation Therapy Association. They like to think of themselves, and maybe they are. I just don't know how they can get the word more out there. They believe that they are the ones setting the standard with a lot of these definitions because of the confusion of what is red light, what is near infrared, what's a sauna, how is that different from this? And so they said, we're going to just take charge and we're going to create the acronyms that are going to be used by everybody. And that's not what's happening. So we already discussed this. Photobiomodulation. Modulate means to modify, influence, or control. So light is influencing your biology. I do like to think of this as light is accelerating your biological response. So basically we're turning the switch on, whether it's in your endocrine system or your cardiovascular system or your lymphatic system, and we're just getting things to work more quickly. So we're taking your innate intelligence and then we're just shifting it into a higher gear so that you can repair more quickly. And I know that's exactly how I got involved with the field of light, because that's exactly what happened with me. So what is light therapy? Basically, in this slide, what we're seeing is that we're using low-level light therapy when we're using an LED device, the light emitting diodes, which is in a pad-based system, which I don't have right in front of me now, otherwise I would show you. What's happening is the red blood and endothelial cells are absorbing the light frequencies, and then what's released is nitric oxide, which is considered to be the miracle molecule. And that is represented by NO, the acronym NO, nitric oxide, which is not nitrous oxide. That nitrous is what the laughing gas is. So nitric oxide does a lot of things in the body. It's a vasodilator. It gets your vessels to open up, which is how it's particularly helpful for your cardiovascular system. And it's how we increase circulation. And that's how we take out pain and inflammation, is through that NO release. It's also antibacterial. I assume it's also antiviral. I don't know why it wouldn't be antiviral. It's part of how we best clear up the terrain. And my favorite LED device is actually a bed. There's these tanning beds. They're fairly expensive, but if you can find one in your area, an LED bed, do it. In just 7 to 10 minutes, you're completely changed. You have blasted every single cell in your body, which is designed to receive and emit light, with light, which is now releasing tons of nitric oxide. You feel your lymphatics moving. You feel your collagen being induced. You feel these amazing changes immediately. It's really awesome. So light must come from a source. So this can be the sun, it can be a device, it can be your very own body. You'll see when we discuss the patches, this patch technology, now we're using your body as the source of light, which is heat coming out as infrared, a kind of infrared frequency, and activating the structures on this patch, which are then reflecting back into the body specific wavelengths of light, which create specific biochemical reactions, if that makes sense. Hopefully it does. So there's wonderful people, educators, teachers in our lineage of light, and probably the most respected who's in our modern day time, who's still alive, is Dr. Michael Hamlin. If you search for him on Google, a lot of his work. I think he has literally it's probably over 500 published articles. He's a professor and researcher for Harvard University, and he's done some really interesting work, very groundbreaking. I believe he probably doesn't spend much time in the light. I think he's really in the lab all the time, studying how our cells function with specific frequencies of light. So I really want to take a moment to thank him. He really is the go-to person. If you want to look up any science-based studies and research, Google his name, go to pubmed.gov and put in his name and it'll all come up. So here's a question I get all the time. What about the sauna? What's the difference between a near infrared and a far infrared sauna? So in the realm of light, when we look at the light spectrum of frequencies, there's not much difference between near and far. But how the body absorbs the near and the far is pretty different. So most saunas companies, the marketing folks, they do not differentiate between near and far infrared. They just say infrared sauna. And they want you to do the research on the near infrared to see all the studies that have been shown, what happens with the near infrared, which is an invisible frequency that the body absorbs. It goes into the bone to help create osteoblasts, osteoclasts. It's how we produce collagen. It's how we can get into the ovaries, depending on the size of the person, versus far infrared, which is just a little bit further outside that visible spectrum. And that is really designed to heat up the body. In the example of a sauna, it's using the far infrared frequency to heat up the body from the inside out to promote sweating, which is a huge value. A heat promotes circulation. Sweating is detoxifying. Those two things right there, you're going to feel amazingly better. So I tell folks, get a sauna, get access to a sauna, go to the gym, whatever, sweat regularly, make sure you're wiping off the sweat as it comes off you, because it's usually full of toxins, in particular heavy metals. You don't want to reabsorb that. And get one not like this. We don't want this device here, means that this is a finished sauna and it's heating up the air. So you go into that kind of sauna with your jewelry on, that your jewelry is going to get hot and it's heating up your body from the outside in. I don't prefer that. I mean, yes, sweating is sweating, but when you go into and now the new saunas are near, mid, and far infrared tri-wave saunas, and those frequencies penetrate into the core, heating up your core body temperature. The air it gets hot eventually, but your jewelry isn't going to get hot the way it does with the finished sauna. So you're going in as deep as possible and then heating up from the inside out. So you really get more done as opposed to the outside in. Does that make sense? So here we see the electromagnetic spectrum. I don't know if this slide thing is on your screen or not, but it's right in my way. So I don't know. What can I do from that? Anyways, it's kind of cool to see the electromagnetic spectrum. We have the gamma rays over here, X-rays, UV rays, and then here we are in the visible spectrum. It's why we can see the red and the blue light and the ultraviolet and all of that. And then we just come slightly out of that visible spectrum and we're into the infrareds and the microwaves and the radio waves. So most of the light that we're working with is right in the middle here. And you see, it's just this huge range. Oh, there it went away. Yay, good. This huge range. What I was told about microwave technology is it can be safe. Mostly it's not safe for your food because the slow food movement is in. The slower you cook your food, the less you're altering its chemical nature, the molecular nature, and you don't want to change its molecular structure. You want it to remain in whole food form. And so if you insist on microwaving, change the power. Don't microwave on full power. Microwave, bring it down to the low power So it's changing the wave here. You see, it's slowing that wave particle down. So it becomes, it maintains more nutrient value in your food. So lots of things happen when you turn the light on. The mechanisms of releasing nitric oxide, which we talked about, which in turn produces ATP, adenosine triphosphate. Maybe you've heard about that. I interviewed Wesley Burwell a few weeks ago about this subject, light therapy and mitochondrial function in particular. There's a lot of discussion about that. And how do we repair our cells, repair on a cellular level that ability to create ATP, which is the energy, the powerhouse. It's what we need. It's what aging is, a loss of ATP production. So how can we do that? Light is the best. Why? Because we're bypassing the gut, bypassing the organs, going directly through the skin onto a cellular level. And then increase circulation. I think that's what that slide says. Okay. So that's what we're doing. That's how we decrease pain. So I like this slide because it's showing us the depth of penetration. There's a lot of confusion. Now, this is again coming back to LED light. And I do sell the InLight system. And people ask me all the time, should I get a red pad or a blue pad? And in a way, it depends on what you're working on. Most of the pads that we have and use are red, and that's getting into the dermal layer here and into the fascial layer, which is where the meridians are, the acupuncture meridians. And the near infrared over here, you see it's measured by nanometers, 850, it's usually between 820 and 850 nanometers. And that's telling us the depth of penetration. Now, on a normal sized person, that we could say that that's getting into the ovaries, getting into the uterus, getting into the bones, especially if you're like working on a hand or the top of your foot and you want to repair a fracture or something, you just simply place the pad there and it's going to start working. It really does. It's amazing. The blue is the most superficially absorbed. So the way I like to think of it, and this is, I got this from Wes, is the red and the blue is warming up the tissue so that the near infrared can pass through into the bone. So you can't go wrong with any of the colors. Actually, they're just doing slightly different things. If you were an esthetician or somebody who wanted to just work on the skin, then the blue is going to be important because that helps to, it's the most superficially absorbed. It doesn't mean it's less effective. It means it's very effective for the superficiality of the body. Burns, cuts, scrapes. There's also been quite a bit of studies done saying that blue light is so antibacterial that it can treat MRSA and all kinds of things. So hospitals should be using the blue wavelength in their lighting system. If they truly wanted to eliminate bacterial infections, they would have adopted this a really long time ago. This is old news, really old news. So here again is just another picture of how the red, to what depth, 8 to 10 millimeters, and the infrared. Now we're, again, this doesn't say near infrared, but it should say near infrared, going all the way to the bone. And then the blue is the more superficially absorbed. So here's an image. I like this because we think, well, light is light is light. So what's the difference? Well, there's quite a bit of difference, actually. So we see on the top, this is the wavelengths, what it looks like from the sun. It's incoherent, meaning, I don't want to say chaos, but it's more chaotic. It doesn't mean it's not good, but this is how the rays are emitting, right? So LED, the middle one there, it's still considered coherent light, but it's got a little bit more wave as opposed to laser, which is very focused, single beam of coherent light. So it is the most challenging for the body to absorb. I wouldn't think of using a laser to change the terrain, right? Although we do talk about laser therapy all the time with ovarian function and egg quality in particular, because of its ability to go very specifically into the ovaries, right? You have to be trained in how to do this. You need to know the joules, the amount of per square inch of light, and the power density of the unit that you're using. It requires a lot of training because you can cause damage. You can actually, some people say you can burn out the acupuncture points also if you over amplify a point with laser, as opposed to LED, which is incoherent light. The body doesn't have to go through an absorption process. It's already, the body is designed to absorb incoherent light. That's why we are sun respondent. So pros and cons to everything. So I like this image because it's showing us the difference between continuous light and pulse light. So we talked before about that progressive pulse, right? So we want the body to experience that change. It's a kind of a waking up, a gradual awakening, or not even that gradual at times, as opposed to that continuous pulse, which is going to be powerful in the beginning. But after the body adapts, which could be 10 minutes, could be 20 minutes, boom, that's it. You have reached maximum medical improvement for that session. And we really don't want to do that. We want to maximize our time together. So Dr. Paul Nogier, he's another one of our light historians, and we have to pay homage to him as one of our ancestors. Acupuncturists know him because of his work in the auricular world, right? He was the one that determined the dermatomes and the frequency layers and how to really treat the ear and which points serve what. And I love this quote by him: "The sickness results when cells, molecules, or particles of matter are out of their normal resonance or vibratory pattern. By repeatedly exposing damaged tissue to normal resonance frequencies associated with that tissue, healing often occurs, sometimes quite rapidly." And that is exactly what's happening, whether it's LED, or laser or the sun. You're going to see very tangible changes in a very short amount of time. So the benefits of LED, they're easy to use. It's easy to plug in, turn on. I like the InLight system because we have what's called the eye mask. We are designed to receive light through our eyes. We utilize the optic nerve to get into the glands in our head. Absolutely essential in fertility because the endocrine system is where it's at. That is what we are doing, is using whatever means necessary to balance our hormonal system, which is governed by the nervous system. So when we go over our eyes, we're able to directly access the autonomic nervous system to get us into rest and digest, out of fight or flight. And that's how we get into a more hormonally balanced place without any supplements. We're talking about things when using light that have very little to do with diet, with functional herbal therapy, with Chinese medicine. This is just a modality on its own. So when you combine it with nutrition, targeted supplements, acupuncture needles, now we are really getting a lot done in a short amount of time. We are really creating some lasting changes. The disadvantages is the plugs and the cords. They're pain. I mean, you have to untangle them, but that's really for the practitioner. So as a user, it's not a big deal. They do break. You have to get them repaired when they break. Some units last for 20 years. Some last for a year. So whatever one you buy, you want to make sure you are connected to a good person that's going to help you. And that has a good warranty, because I bought cheap things off the internet just to see how they compare, and they say they have a lifetime guarantee. Well, they don't if the company doesn't exist. I mean, so maybe you don't have to, maybe they'll give you your money back, but you don't want your money back. You want a light device that's going to help you to create a biological change. So just be careful. Price, of course, you get what you pay for. Sometimes you're spending more to get that relationship with the person. And sometimes you just want the most power density that you can possibly get, depending on how long you've had something. something. There's a big difference between acute and chronic, right? So the longer you've had something, the harder it is to affect a cure. Oh, and then I skipped this power density. Yeah, you want to have enough power so you actually are going to create the changes you want. For people that have a lot of abdominal fat or fascia, I tell them use the pads over the ears, because the ear's a microsystem, so we can really get a lot done in the whole body through the ear. So with most lasers, you wouldn't have to work on that, worry about that. So here's a picture in the bottom left corner of one of the beds that you lay on, which is pretty cool. I mean, if you've never experienced, you cannot even imagine how different you feel when you're lying on that much light, that much power. I did have the opportunity to go on one of the beds, like at the top. There is a dentist in Manhattan. I assume he's still there. I can't remember his name, but he has a Thor laser bed, which is top of the line. It's their incredible investment. I retail back in the day when I was looking into trying to manifest one for all of us, I think they were 120,000. Well worth it. If that's within your budget, get one for home, get one for your clinic, for your neighborhood, your family, whatever. If it's not, then just search for people, because it's not that expensive to do sessions. I think it's by the minute, most of the places. So otherwise, down here, we have a pad-based system. Again, going in for a massage or acupuncture treatment or standalone light therapy, you will feel a huge benefit after 20 minutes. So it's well worth your time. So then we come on to laser. Laser stands for light amplification by the stimulated emission of radiation. So the benefits of a laser, like I said, is more power, a depth of penetration. You're very precise where you're going, whether it's pain relief or ovarian function or any organ function. Every organ has its own frequency layer, and that's based on the work of Dr. Paul Nogier. So we know that. So we can just dial in the frequency. If you're having liver issues, we can simply give it some pulses with the laser and help it to restore itself. Tons of research, endless amounts of research on PubMed.gov. So all of the research now that's being done in LED has really piggybacked on laser. And so without all of this research in laser, I don't believe we would have all of these studies done with LED. So we really want to say thank you to the laser industry for spending so much time and investment in really getting some valuable studies out there. So the disadvantages is they're expensive. I mean, a good laser is going to be 30 grand minimum. The really high-end lasers that do like facial rejuvenation and surgery and all kinds of things. I researched one in Israel. I think it was they started around 120,000. And you really have to be trained, and you have to wear goggles. You really have to know what you're doing. The more affordable ones, like in the clinic, the $30,000 lasers, the disadvantage is you have to be there. You have to hold onto this laser for your patient, which sounds fine if you're doing a person here and there. But if you're seeing 20 a day, as opposed to a pad-based system, you simply place the pads directly on the skin, you press start, and you leave the room while they relax. So LED is easier to use, definitely. And you have to be careful. You can do too much with laser. So you have to know when too much is too much. So this is what we just talked about here. Laser from fertility to cosmetic surgery. Laser is very, very potent. So yeah, we can see they're doing like eye surgeries, all kinds of amazing thing with light. I wrote an article years ago, well, in the class that I teach with Lauren Brown, who's right there, is light the new needle? Because I believe it is. It's very powerful. So this is a kind of light that most people don't know about. It's called RIFE. Royal RIFE was an amazing healer. He studied his entire life. He studied, well, his career anyways, frequency. and how the cells respond to specific frequencies. He discovered the cure, or not the cure, he discovered the frequencies that eliminate cancer cells. And then I believe his career went downhill after that. So a RIFE light is very cool. I think I use one here in the clinic. If you come in to see me and you have a sore throat, you are not going to leave with a sore throat. We can literally blast it out. The challenge is if you come in and you're feeling not great, you're tired and you don't know exactly why, then it's harder to specify what frequencies we're going to use. So I do use this analogy all the time in the clinic. It's the difference between like the Peace Corps and the Marine Corps. The Peace Corps is the LED light. LED light is placed on the body, gets it to heal itself and repair, and we just start rejuvenating the body beginning on the cellular level. The RIFE light is much more like the Navy SEALs or the Marines. It's designed to go in and destroy unwanted pathogens. That's all it wants to do. So it stirs the pot up quite a bit. So a lot of people use it for Lyme disease and long-term anti-cancer protocols or any kind of viral invasion or bacteria. So the benefits, it works very well or standalone with acupuncture. I put my table in front of the RIFE device. The needles grab the frequencies, drive it deeper into the body. The RIFE doesn't need the needles to do that, but the needles create much more of a conduit for the energy to pass more freely throughout the meridians, because we want to get your energetic system completely open and moving so you can heal the most quickly. I already talked about, it's easy enough to program. You have to learn a little bit, but you can do it. It's the one I bought was $5,000. I don't know what they cost now, but it's well worth the investment. Somebody has something chronic, you could probably get one used on eBay. I'm hoping that somebody will create, and there are some like the photon sound beam. There's some more affordable ones that are these RIFE light frequencies that are destroying unwanted pathogens that you can use at home. I'm still looking for that perfect one that you could say, I'm going to spend $1,200 or whatever, and I'm going to live with this device on anytime I'm home. The thing, you have to be careful because you're really dumping a lot of toxins. And so you want to work with the right binders to help, or chelators to facilitate the unwanted debris out of your body. So sometimes, it's like shaking up one of those snow globes. You don't want it to just settle down. You want to move it out. So if we're going to stir things up for you, we want to make sure it's moving out. So to do like an ionic foot bath or something at the end, now you're really getting rid of a lot of unwanted stuff. So disadvantages. So the first year that I got mine, it was hard for me to stand. I was spending, I don't know, 20, 30 hours a week standing in front of this. And it was challenging in the beginning. I got a headache. I couldn't handle it by the end of the day. I could not be in the room with the RIFE on. About the end of, I don't know exactly, probably a year, that all cleared out. I can live in front of it now. And so it does work. It does help. But there is a breakthrough point. You have to keep going. And so you have to be intuitive with the frequencies. That's a disadvantage. It comes with a very thick book of hundreds, literally hundreds, if not thousands of frequencies that you can program in there. I was able to, with the help of a friend, program in the anti-COVID frequencies. We contacted some practitioners in Germany, and they had created these frequencies to eliminate, decrease, help destabilize the COVID virus. So I've used that a lot. It helps, especially when it's combined with the right functional herbal therapy. Oh, here's a picture of the RIFE. Yeah. This is the MOPA generator. It makes it a lot more stronger for the plasma tube, which is how I prefer to deliver the frequencies. But you could also just get a handheld thing. You actually hold on to the probes and you get they come with little like towels, which you get wet, and then you're holding onto these wet probes and getting electricity delivered through them. And so it's a little bit, some people, I'd come in after 30 minutes or so and they were gripping onto them so tight, they were developing pain in their hands. So we just eliminated all of that, and the wet, it got a little bit much, which is why I invested in the amplifier here. So it makes it a lot stronger and better. So the last thing that we're going to talk about is the patches, like I said. So I've already explained this. Now your body becomes the source of light, which we know that our cells and our DNA have biophoton emissions, right? There are measurable sparks of light coming off of our cells. So basically, I was thinking about it the other day, like a way to explain this is, so we're using solar, we're, creating panels, which are captivating the sun. We're maximizing that energy. We're creating these batteries that cars run out. So we're maximizing this kind of electrical energy. But what about the energy coming off of our bodies? So we're emitting light in the form of heat constantly, and nobody's really capturing that, are they? Well, now they are. Thanks to David Schmidt, who is one of many medical heroes. He figured out, how can we capitalize on this greatest resource that we have, which is our very own energy. And what he got a patent on was the crystalline structures on the patch, which are activated by our body's heat, and then creating an endogenous response. So we have patches that create stem cells that increase glutathione levels, carnosine, DHEA, which is pretty amazing. Again, anytime you can bypass the gut, bypass the liver, go directly into your cells, you're really shortening the treatment time, and you're maximizing the effectiveness, because the gut, remember, is full of dysbiosis, inflammation, bacteria. So it's, every time you take a supplement, it has to go through this stage, and everybody's got something going on with their gut. So anytime we can bypass that, it's better. So the benefits, easy to use, affordable for most people. We can customize your response. One of the main researchers for LifeWave in particular is Caitlin Connor. She is a Chinese medical doctor, so she's one of us. If you're an acupuncturist, it's kind of cool. She became fairly famous for her research, so it's really awesome to see her on a very respected international platform as a acupuncturist. She loves the lab. I don't know that I would love it that much, but I'm glad that she does. So the disadvantages, unless it's a pain relief, it's not a disadvantage, it's a hurdle. So the main thing that's hard for people, if you go on a laser, you're going to feel that. You get into one of those Thor laser beds, you're feeling it. Same with LED. The patch, you might not feel it. The ice wave patch, which we use for pain relief, for reducing fever, for PCOS, you feel that right away. Most people, if it's going to work, you're going to feel it in 20 seconds. It's incredible. And I've experienced it myself. I've seen it time and time again with patients, just like, wow, that was amazing. If we are going to work on mobilizing your own stem cells, you're not going to feel that. You may feel more energy. You may sleep better. Your skin may improve. But nobody ever says, wow, I feel my stem cells being mobilized because of these peptides that are increasing in my body, and I feel it. No one says that. And so a lot of people say, well, I don't feel anything, so I'm not going to keep going. And so that is a big obstacle that has to be overcome. We want you to keep going. Eventually, you will feel it. You will feel. What happened with me is I felt it when I stopped doing it. So that was a big change. So I didn't feel anything for a while. I'm like, I'm going to take a break from these patches and move on to something else. And then I was like, wow, I don't have the same amount of energy that I had before. And so I went back to putting the patches on. I'm like, okay, this is good. Not that the goal is to be dependent on the patch, but at whatever stage I was in at that time, I really looked forward to it. So yeah, the benefits are cumulative, and therefore the compliance, if you're using these as a clinician yourself, the compliance can be a little bit low because people don't feel that. So here's a picture of the patches. It's a class 2 medical device, like a Band-Aid. You can use them on babies. You can use them on animals. They do not have to be directly on the skin. They can be on your clothing. You can put them on the inside of your shirt, on the inside of a hat. We have a whole brain protocol. It's pretty interesting. So no matter what kind of light you're using, you're increasing your mitochondrial function, okay? There's a lot of science behind this, okay? So it doesn't matter what kind of light you're using necessarily. This is the true, what I call intelligent aging. There is a lot of science behind this. If you're interested in how cells function and repair, then do this, put in mitochondrial health and light therapy, and you'll have lots of fun. As an acupuncturist, I love combining things. Well, as an acupuncturist, as a Pisces, I should say, the two fish swimming in opposite directions simultaneously. I'm always combining, why not? Let's do as much as we can. If I have somebody for 50, 60, 75 minutes in the clinic, I am going to do everything that I can during that time, because I don't have a big program where you're coming back for 10 sessions or 20 sessions. I've seen people get cured in one session. 2 20-minute sessions of LED light repaired my labral tear. And so that was nobody said, oh, you have to come 20 times. They said, let's see what we can do. And I was amazed. I had a complete recovery in 40 minutes total. So let's try to get the job done, folks. I do think of increasing our nitric oxide levels as increasing our qi. This is Chinese medicine. We want to increase our qi. Most of us have deficiency of qi, or our qi gets stagnant, stagnation. So we want to get our levels up and get them moving. So a lot to say about that. I wrote a story for the Oriental Medical Journal about does nitric oxide equal qi? Everybody I asked said no. And so I had to prove, being the rebel that I am, that actually it is by definition. So I want to show you a slide before and after. This is a blood sample taken from a volunteer, and then he did 20 minutes of LED light therapy, and a repeat blood sample was taken out of this exact same finger. He did a 20-minute LED light therapy session. And this is what happened afterwards. It turned into this. So pretty amazing, right? You can see the cells are no longer clumped together. There's light coming off of them, and they just look so much healthier. So we can actually think of that we are doing acupuncture when using light. We're illuminating the whole channel system. So if you happen to come in and do light therapy pre and post transfer, at some point, I'm sure this will be an add-on here where people maybe don't want to do acupuncture for whatever reason. A lot of people have a fear of needles, or they just want the warmth of the LED instead. And so I want you to think of this as a kind of light-based acupuncture. This is meridian illumination. There's a lot of things to say about this. It's a fascinating study of how we're moving energy through the channel system. This is the bioelectrical part of our system. And so I have a lot of slides here. So yeah, frequencies are safe for everybody. We use them on babies. You have to be careful, but absolutely everybody is going to benefit from increase of light. The key is, I'm glad we're at this slide. So if you want to look at using light to enhance your fertility, that would include laser, LED, and patches, okay? For pain relief, again, LED, patches, laser. Immune support, then you would have to include RIFE for that. So, and LED, not so much laser. The psycho-emotional part has to be LED because we have the eye mask. The patches are going to help long-term endogenous change. Not RIFE for psycho-emotional stuff, but for purification, detox, definitely RIFE, definitely LED, definitely the patches. And I would say laser only if you're looking to detox your ovaries in particular. I don't think that we can laser the thyroid. I don't own a laser. I wish I did, but I don't think that we can laser directly over the thyroid gland the way that we can the ovaries. But remember, the endocrine system is so interconnected that if we support the ovaries to function better, it's automatically going to support the thyroid to function better. And those are the two main imbalances that I see in the fertility world. So fix one, fix the other in a perfect world, which it is sometimes. So you have to figure out what your budget is and work within that. Everybody has a different budget, as we know. So feel free to reach out to me if you want more specific information. We have a referral network. So, Google is going to help us with that. So we can find out who's in your area. Not, unfortunately, a lot of healers don't have great websites. They do amazing work, but it's hard to find them on the internet. So I do have a lot of resources of folks. So feel free to email me, visit my website. You can call me or text me, and I promise I will do my best to respond to you. And so when in doubt, patch it out. Have a wonderful day. And please let me know what your questions are. Okay, thank you.